may I introduce Professor Donna Hall. And Donna is the chair of New Local, which is a sort of think tank and progressive organisation trying to promote community action, and is also the chair of Bolton NHS Foundation Trust. Over to you, Donna. Welcome.
Thanks very much, Ian, and thanks very much for the invite, and to you and Steph for helping me navigate this session. Hope everyone's okay. It's absolutely glorious in here in Bolton. Beautiful, beautiful sunny day. So yeah, we should definitely be celebrating it. So a little bit of background about me. I've been a kind of local authority chief executive before I came into the NHS. So for about 20 years, worked in local government as either a deputy chief exec or a chief exec. I don't know if others are hearing quite a bit of feedback. I don't know if maybe perhaps somebody's not on mute. If you could just double check, that would be brilliant. Okay, thank you. That's a lot better. So my last kind of chief exec job was at Wigan, and I don't know if colleagues have seen that King's Fund report that they wrote up about the Wigan deal. So for those that don't know about the Wigan deal, it was a long-term transformational change, and it was a huge kind of shift towards community power and community ownership that we embarked upon in 2011, and is still going on now. I retired 2 years ago. So in my career, I've worked, whenever you look at changes in leadership within organisations, you tend to see a new strategy develop. So I do a bit of work with Birmingham City Council at the moment, and they've had 4 chief executives in 7 years, and they've had 4 new strategies in each of those 7 years. So there's been no continuity. There's been no kind of clarity of purpose and constancy of purpose within Birmingham, and it's ended up leading to lots of problems for them, and I'm sure it's the same up in Edinburgh. I think it's the same universally. So when I started at Wigan, my background had been much smaller organisations. I started my career in the community and voluntary sector, and I've always been passionate about working with the community and voluntary sector in a different way. We had huge cuts to make back in 2011 at the start of austerity in Wigan, and we had to make £160 million worth of savings over a 10-year period. So we knew we would have to completely repurpose the organisation. We couldn't just keep chopping little bits off each service until they were barely recognisable. We had to redefine our role. And we saw that the assets that we did have were in the community and voluntary sector and in our people. So 323,000 residents living in Wigan Borough, some fantastic social networks and community networks, big on sport in Wigan, so a huge number of sporting organisations and LGBTQ plus support groups, mental health charities and support groups for older people, people with dementia, etc. But we weren't working with those groups in a meaningful way in public services. We were kind of operating down parallel tracks. They were coming to us with a begging bowl every year saying, please, can we have a bit more money? And we were issuing them with a contract for hardly anything, and then micromanaging that contract. And we were spending more on monitoring grants that we gave to the community and voluntary sector than we were actually giving them. So, it wasn't really good value for money. So we completely changed the way that we worked with the sector. We started using the kind of basis of trust, that we trust you to deliver things. We will give you longer term funding to do fantastic creative things within local neighbourhoods and with communities of interest. So, go away and do the amazing stuff that you do and work together to do it. Don't just don't just work in your individual organisations. Bring services and wrap them around individuals and families and neighbourhoods. So that was our kind of mantra. We worked with a woman called Hilary Cottam. I don't know if you've read her book, Radical Help, but we kind of based everything that we did on the principles of an experiment that we did in Wigan. So we asked Hilary to look at 25 families who were living in social housing, whose children were on the edge of being taken into children's social care. And we worked with lots of public servants who were working in that neighbourhood, police officers, housing officers, drug and alcohol support team, anybody who was trying to support families, social workers, NHS staff, GP, schools. And we mapped out everything that we were doing to support those families. And we found that we weren't actually supporting them in a meaningful and connected way. We were constantly assessing them and referring them, reassessing them, and checking whether they met the threshold to access our individual services. And if they weren't ill enough or poor enough or in enough debt, they couldn't access the services, and they were told to go away, get worse, come back when you're worse, and then you can access the services. So we weren't also building a relationship with them across public services. We were judging them, assessing them, and putting them into little service silo boxes. And we were spending between $250,000 and $500,000 a year per family. And at the end of the year, their outcomes were worse than they were at the beginning. So for me, that was a real salutary lesson about how to reconfigure public services and think about commissioning some of the brilliant groups that we'd got in the community who could support those families in a much more responsive and proactive way than we could in remote public services. We also did loads. It was a huge organisational development piece. So we did loads with our staff on something called the B. Wigan experience, which was about our values as public servants working together with the community and voluntary sector and local residents. And we based it on behaviours. And this is what really changed the culture in the place. It was around being positive about the people that you serve, being accountable to the people that you serve. You are public servants, you're there to serve the public, and finally being courageous. So if we carry on doing everything that we've done for the last 40 years, we're going to just end up with the same outcomes or worse outcomes. So we've got to try new things. And that's where the deal was born, a kind of social contract. We put 13 million, excuse me, into the community and voluntary sector to commission differently. We asked them for their ideas, and we came up, there were some amazing projects that were funded that would never have been thought of by people like me sat in darkened rooms in ivory towers. They were very grassroots projects that were remarkable. So one of the outcomes that we achieved at the end of that 10 years was we were really focused on healthy life expectancy because it was going the wrong way. So the years of life that people live without serious illness. And in Wigan, in some wards, it was 50 for men and even worse for women. So we wanted to reverse that. And over a 10-year period, we managed to add an additional 7 years healthy life expectancy in our most deprived wards, which was our real goal, working with the community and voluntary sector to achieve that. So I did some slides, and I don't know, Ian, whether they're available, if we can put them up. If not, then I can just talk around community commissioning. So basically, I now chair a hospital, and I see from the sharp end, particularly during COVID, the way that our services don't wrap around people. Take the example of my mum, who was discharged from the organisation that I now chair a couple of years ago. She wanted to die at home, so she was discharged. And on one day during that discharge process, she had 22 separate bits of the health and care system came up her drive that day. None of them came in the right order. They all came in the wrong order. None of them knew anything about her, anything about what she liked, what she enjoyed, her family and a support network around her. They were there just to deal with that one little bit of what was wrong with her. So, you know, I don't know what if this is happening in Scotland, but in England now, the integrated care system is to try and resolve that. So bringing together clinical commissioning groups with acute providers and community providers and the community and voluntary sector to try to change the way that we commission services, very much more community, very much more responsive and more connected. So this is a few slides that I pulled together for you. I also now chair New Local, which is a think tank which has about 70 people who are members of it. You're more than welcome to join. And it's basically an innovation space where we try to think about how we can unlock the power that is in our communities already. And we've got 70 people really passionate about that, really chomping at the bit to unlock community power. And it's becoming more of a thing. I also know it's becoming more of a thing in Scotland, which is great. But I think sometimes what happens is people understand the theory. They've all read The Community Paradigm that I'll talk about in a moment. They've all read Radical Help, but putting it into practice is the hardest bit. And it's that leap of faith. And it's that really brave, courageous leadership to say, come on, what we're doing now is going to fall over if we don't change the way that we're doing it. And we've got to try this new thing. So if we can move on to the next slide. Just bear with me a sec. Sorry about that. Right. So according to the Institute of Commissioning Practitioners, what is commissioning? Securing the services that most appropriately address the wishes of the individual service user, making use of market intelligence, research and planning accordingly. But now in 2021, we've got a real change to the commissioner provider split. I never liked it, I'll be honest. And I don't know if you've got any commissioners on the call. I don't know if you liked it, and I'd be really interested in your views. For me, it was always very artificial. And for me, the best place to do creative thinking is to co-produce things with local people across commissioners and providers, using data and analytics, but putting the person and the person with the lived experience right at the heart of that service redesign. So creating the integrated care systems, I think, is a step in the right direction. As long as they don't become a huge clunky bureaucracy, then, you know, I think it can only be a good thing. There needs to be a really strong focus on community engagement and put the voices of people with lived experience. So just give you an example of some of the stuff we're doing in Bolton. I'm sure you're doing similar work, but we, anytime we redesign a service and we're going through the whole organisation like this, we come up with a panel of people with lived experience to share their ideas. So we're doing mental health support at the moment, and drug and alcohol rehabilitation and reablement services, trying to keep people fit and well at home. And all of that is being done with people who've used those services and the people around them, their carers, their family members and frontline staff, because they know where the problems are. They know where people fall through the cracks of these services and where we don't support them to be fit and well. We don't use an asset-based approach to working with them. We process them, really. And that's how the NHS, through the state paradigm, was created, to do that, almost like a factory model. And I think in the community paradigm, we really strongly argue that we're not arguing for a kind of big society type model, but we think the state needs to work with the community hand in hand to change the way that it works. The market paradigm, you know, we've seen with the outsourcing of test and trace to Serco, and, you know, the huge outsourcing that took place in the 80s and 90s, it didn't work. It just created a separate silo which didn't connect back into public services and into communities. And I do feel we've got now a real once-in-a-lifetime opportunity to shift the way that we commission. If we can move on, please. So the current context is you've got huge resource constraints post-pandemic, and we saw, you know, despite manifesto pledges, we saw the Conservative government putting up tax yesterday, which was not supposed to be part of the plan. So with social care, you've got a national tax, two sets of national taxation. You've also got a local taxation in terms of the social care precept in council tax. So it's really confusing. And it's almost as if whenever we get a new problem, we have to create a new project, but we don't get rid of the existing project. So it's just becomes a really disjointed patchwork quilt of initiatives. We've got increasing demand as waiting lists expand. You know, we've got huge numbers of people who are dying because they weren't seen because of COVID. So, you know, huge numbers of people waiting for help. Healthy life expectancy for the first time in 50 years. And since the creation of the NHS is going the wrong way. So Michael Marmot came up to Greater Manchester and did a brilliant piece of research for us, Build Back Fairer. Again, it's all available online if you want to read it. And he said, you've spent millions, billions in the NHS on building new hospitals, but you've got some of the worst health outcomes in the whole country. People are becoming iller, more seriously ill sooner in their lives, in their 40s, sometimes in their 30s. And that long-term projection of their life expectancy, their dependency on services, and their quality of life is deteriorating, which, you know, for one of the richest countries in the world is just horrific. Areas of deprivation are worst hit. We've been doing some work as a board on where do babies die in childbirth. We started off with maternity, and it's in 2 wards. No other babies died outside of those 2 wards. And they're the poorest wards. So, you know, and it's not just around maternity, it's everything else that we're doing. So we've got to have a very bespoke place-based deprivation focused response, in my view. Primary care and community care are overwhelmed. I know there's been a lot of criticism of GP practices, but certainly in the system I work in, they are completely overwhelmed. And mental health and acute services are also overwhelmed. So unless we try something different and we make that leap of faith, I'm really worried about the future of health and care. We can move on. So there is another way, in my view, and I talked about this document called the Community Paradigm. We pulled it together in 2019 at New Local, and it's really gained traction, and it's really resonating with people for some reason. So, what options do we face? Do we grow the state to get ourselves out of this issue? I don't think that is the solution. We spend millions and millions on growing the state, and yet it doesn't connect back into the reality of how people live their lives. Do we outsource things? I think that's not worked, and I don't think that's the solution. We're spending 15 million a month on paying Serco to do a horrifically failed test and trace scheme. But I think we have got to reconnect with community and try to build on some of the assets that we have in our community. I don't think this policy will come, certainly not for the next few years, from the government. I think it's got to come, certainly not in England. I think it's got to come from localities. Silo services that don't wrap around the person, repeated assessment, as I said, was happening in Wigan. And relational working is rarely found. And embedding that relational working is really hard to do, but essential in my view. We can move on. So I think if you are going to make this leap of faith towards community commissioning, and there's a document again that we wrote that I can send through to Ian and Steph, called Community Commissioning, Unleashing the Power of Local People. And it was kind of like a sister document to the Community Paradigm. So the 4 key questions we need to ask ourselves when we're thinking about a service is, what is the nature of the service? Could it be entirely commissioned by communities? What is the nature of the commissioning network, and how do you work together, and how do you hear the voice of local people? What is the method of power transfer? You've really got to seriously question yourselves. Are you thinking about how you unlock power, or are you just perpetuating status quo? And what is the depth of participation? If we can move on, please. So the benefits of commissioning, using the community to commission and to work with them and to hear the voices of people with lived experience. In my experience, it improves individual well-being. It brings people together in local areas around a common purpose. People have much more say, and we like having our say, don't we? Everyone does. Better decisions and less inappropriate services. Very often, I remember when I was at Wigan and I was in charge of the clinical commissioning group as well as the council, we were commissioning 5 different lots of musculoskeletal services. None of them worked together. All of them had a different methodology, but it was just a historical legacy. And we were spending millions on these 5 different services, and we'd never reviewed them over the years. So less inappropriate and costly, wasteful services. We had 7 integrated place-based teams where everyone worked together across housing, the job centre, the school, the GP practice, the council, and we had a plan for families who we knew needed our support. And it was a connected plan. They had one key worker, one key contact person, and very often that we were commissioning services from the community and voluntary sector to support them. It improves staff morale and satisfaction when you can see, nobody goes into public services to just tick boxes and to pass people around the system. They go in to help people. So when people can actually see that their efforts are being having an impact, it really does boost staff morale and satisfaction, and you get better outcomes. As I've said, in Wigan, we, despite taking all that money out, 160 million, we stopped doing the things that didn't work and started doing the things that did work, that were local. If we can move on, please. So that's it really, and I hope that's been interesting, useful, relevant to you, and I'm really keen to hear your views. Thanks, Ian.
Thank you, Donna. That was very helpful. I'm really taken by a couple of points that you made there. But perhaps one of the things and one of the lessons that I've seen relearnt time and time again in my 23 years in the voluntary sector is this idea of when you're doing service redesign, you involve the communities, people that are using the services, people around them, carers and families and stuff. Why do service leaders and commissioners forget that very basic point? What happens to having to remember the same thing?
I think there's a number of things, Ian. I think sometimes it's just custom and practice within organisations. I think it's the way, it's hierarchies, it's status, it's power, isn't it? And it takes a courageous leader to give away power and to admit that they're wrong. And I think, I'm not being critical of colleagues, but I think that's not the way, certainly the NHS works. It's not the way local government works. It's quite paternalistic. We're paid to have the answers, to come up with the solutions. And, that's why we just plough the wrong furrow sometimes, blindly going on. We might be receiving loads of complaints about a service, but we don't step back and reflect and say, well, maybe it's because we didn't involve people in the first place. So for me, it's just common sense. It's good use of resources, and it's, why would you not involve the people who are receiving those services? It's bonkers. I chair a charity for people with learning disabilities as well, and again, every single bit of what we do is designed by the people who use the services and by the staff. It's just basic common sense, I think.
So when you were at Wigan and you were chief executive of the council, how did you lead by example, and how did you overcome sort of internal resistance? What did that feel like?
It was really hard, and that was the hardest bit, actually, Ian. We could convince the politicians, so they went along with it. It was a Labour council, really keen to protect the most vulnerable people or valuable people within communities, but at the same time having to make all these savings. So we persuaded them. The people I found it the hardest to persuade were our children's services team, I'll be honest. They were very risk averse. They almost saw, this sounds awful to say, but some of them almost saw people as the enemy, families as the enemy, that they had to protect the child from the family. It was almost as if they didn't work for the place. They worked for children's social care nationally. They didn't have that connection to community, and they had a set of rules they had to apply. I think that's because of obviously really high profile, tragic cases of babies and children who've died. The whole service has become very anti-involvement of families, anti-involvement of people, when the real support structure for those families is in the local community. They've kind of been cut off from that support network and put into a box labelled high risk. And that's not good for anyone. No one wants to be in that box, do they? Not being believed in, not being trusted, not being supported. So I think one example is we found we had around 800 babies that had been taken into care over a 5-year period in the delivery suite, from around 100 women over that time period. And what we'd done is we'd just processed the child, because that's what the Ofsted and CQC rules say we had to do, and got the child fostered and adopted, rather than thinking about working differently with those mums. And we launched something which is a charitable thing. I don't know if it's in Scotland, called Pause, a national charity which works with women who've had repeated children taken into care, gives them hope, confidence, self-esteem, thinks differently about, we work. So I think it is that whole person, whole family, whole societal support that we've got to move to. But no, it felt awful because I had to have lots of falling out with people.
Yeah. And did you make progress through one-to-one persuasion, or was it by sort of writing policy documents and things? I'm trying to get down. In Edinburgh, we're in quite an interesting place where there's a lot of buy-in from all levels of politicians, of officers, of the volunteer sector, of people that we work with, as stakeholders, to use that jargon. But you'd hinted on it in the slides, is people have read the stuff. We really like the new local community paradigm, etc. But breaking to the doing phase is proving to be really quite hard, and you don't want to make a mistake, etc. So getting underneath perhaps how some work that you've previously done delivered on change, I think is really helpful, actually.
Thanks. Yeah, I think the way we did it, and it wasn't just me, it was very much a team effort. Was instead of having, the first thing was it was about the team and the team working together and backing each other, and making it so that you know, if something happened that went wrong in children's services, it was all our problem. It wasn't just children's services, it was all of us. So that was the first step, that team cohesion. The second step was, you know, the policy was the deal. It wasn't, we didn't have separate policies for everything. Very often you find that there's different policies and then there's a community policy that doesn't cut across. Whereas the community policy was the whole thing for us. You know, that it was, and I'm putting it front and centre. So it's not separate from community wealth building. It's not separate from, you know, your economic strategy. It's part of, it's everything that you do. You join the dots and you embed it within the way people work, the way people engage with families and with each other. And then I think you will always get resistors. But if you've got that band of people, that kind of, the resistance we used to call ourselves, because I wasn't the chief exec when I first started, I was the deputy chief exec. So we formed a band of people who were like La Resistance, and we were there to you know, champion this community cause. And you know, it wasn't popular with everyone. We had to make some tough decisions. When I got to be chief exec, the good thing was people who were blocking it tended to be, I'm not caricaturing everyone, at middle management level. So frontline staff got it, senior people got it, and if they didn't, we kind of exited them with dignity. But if, you know, it was mainly middle people blocking it. So we would all be signed up to it, all thinking how wonderful it was going. And then we would find that middle managers, either within our own organisation or between organisations, were sending each other solicitors' letters about service breakdown and failure to comply and all this. So, you know, it locked in hand-to-hand combat when we so it's got to run right through. It's got to be about a belief system, almost like a religion, that, you know, people really believe this is the right thing to do, and then they just go and do it, and they're backed and supported. So the thing about courage was, we said, look, not everything we try will work, but we back you to try this new thing. Now, not often does that happen in public services where you get that backing from leaders. Very often it's, don't do this, don't do that, follow these rules. And I think that's got us into the mess we're in now, where we've created these medicalized silos that just are not the way that people live their lives. And they don't reflect the reality of people's experience of using our services.
Yes, I mean, your commentary earlier about building the best hospitals in Lancashire, etc., and yet you have the worst health outcomes, I think is a salutary lesson, isn't it? It's not about buildings and hubs and centralised services. It's about communities and people and delivering locally, isn't it? One more conversation point, and then we'll look at some of the questions that are starting to come in. Think about your questions, guys. If you want to pop them in the chat just now, that'd be really helpful. Ending existing structures is an interesting point that I think we're maybe worth exploring, because you've described there how patchwork quilts of projects where perhaps we never finish off the old ones, or we never close them down and we just add to it, etc. But obviously when you had £160 million to save, you had no choice but to close things. When you don't have that fiscal pressure, which everybody does actually have, but it's sort of like in a theoretical way, how do you stop doing something and promising that the new thing is going to be at least as good, but actually you're trying to sell it as better?
Yeah, I mean, I think I'll just give you an example of day centres in adult social care. So we had 27 day centres that were awful, you know, scruffy municipal buildings, really horrible places where people were just lumped together in rooms who didn't know each other, who didn't particularly like each other, you know, who didn't have any shared interests or hobbies, and you know, they didn't have any independence or rights, really. So you get people with acquired brain injury, say maybe in a motorcycle accident, sat with somebody with dementia, you know, advanced dementia, not building on the social connections and the friendships and the things that people love to do. You know, none of us want to end up in that situation, do we? I wouldn't. You know, I like dogs. I'd like to be buddied up with somebody who likes dogs, you know. And so we invested in, just to give you one example, we closed almost, I think we only ended up with 2 day centres. Some of the day centres we passed to local community groups who did a brilliant job of running them. We passed swimming pools to the local community libraries, all paying people, you know, the living wage. It wasn't like a big society type thing, selling off public services on the cheap to the voluntary sector. It was really good quality jobs for people. You know, and the Pelican Swimming Centre, which is one of the most famous examples in Wigan, was given to a local swimming group with a budget to manage it, and they made a profit where we made a loss, because we were just running it as a, you know, oh, it's that pool X over there, whereas they said, this is our pool in Tilsley, it belongs to us, we want to make it brilliant, we're going to market it to local schools. You know, it was that local granular knowledge that we didn't have. One of the things we did to replace day centres was we funded brilliant things. I mentioned Wigan's a great big sporting town, and rugby is a big thing. So we funded a rugby memories group, which we did in partnership with Wigan Warriors, where they would have, every day they would have a brilliant kind of get-togethers of people, whether with or without dementia, who could talk about their player, talk about their program, bring their old programs in, meet some of the current day players, you know, and they met with young people. So it was like an intergenerational thing based on what people loved, what people connected, you know, the love of sport, the love of cooking, the love of music. Those were the things that we based our services on, rather than institutions.
Brilliant. Let's have a look at the chat. There are a couple of questions in there. Yambert's asking about creating a space where practical solutions are formed and relational working is supported. Do you have a model and example of that, perhaps?
Yeah, I mean, we didn't have like what does Dominic Cummings call it, a moonshot team or whatever. We didn't have anything like that. We just made it everyone's job, whatever they did, to think about how they could work with the community in a creative way. So it was everyone's job, whether they were sweeping the streets, whether they were the director of social care. You know, that space was everywhere all the time, 365 days a year. We didn't have like a change team or anything like that. We did a lot on organisational development to embed it. So we spent, I would say 90% of the deal was OD, where, you know, we got people together, you know, managers in particular. We found that the way people felt about their job was largely dictated by how well they got on with the manager and how empathetic the manager was, and very often they weren't. So we did a lot of work on how do you manage people in an empathetic and compassionate way? How do you listen differently? We used an anthropologist to help us retrain everybody to listen differently, to use ethnography and to do deep listening, rather than just making snap judgments about people and not really listening in a deep way. So I hope that's all right, Ian.
I think that really helped. I don't know if but you want to come in there, perhaps there's a follow-up. Would that be helpful?
Yeah, it was also thinking about it from, I suppose, from the kind of community and voluntary organisation perspective is I suppose we very often find it difficult to occupy that space with our public partners in a purposeful way. So I wondered if you, when you were working in Wigan, looked at how you involved communities in making decisions and what kind of methods you'd used.
Yeah, I mean, I think we did participatory budgeting. I don't know if you've used that up in Edinburgh, but, you know, to design a budget. Oh, right, okay, sorry about that. I mean, we got quite good feedback from the work we did when we were setting our budgets. It's been a little bit more difficult during COVID for them, I think, but that participatory budgeting was good and really seemed to work well. And we did that also with the youth cabinet with young people, and got slightly different results, as you would do when you're working with different types of people. But so we did that. We held citizens panels for certain key decisions. We completely changed the way that we, as I said before, commission services through this deal for Communities Investment Fund. And on that decision-making panel, it comprised the people who'd received it the previous year. So it was very much kind of, it wasn't grant givers just sitting, thinking, judging. It was the community and voluntary sector themselves making the decisions around where that 13 million went. So it was kind of at every level, really. It wasn't just a kind of one-off thing. It was at every level, all the time, every day. I'm not saying we got everything right. I'll be honest. You know, I think it would be just, you know, bonkers to think that everything's perfect, but we tried, and they're still trying now.
Is there an area where you wish you'd gone further?
Oh God, yeah, definitely. I mean, I'll be honest. You know, and I don't mind people repeating this, but the clinical commissioning group in Wigan were horrific for 5 years. Horrific. They just would not cooperate with the deal, and they just saw it as a bit of a hippie project, you know, rather than something really deep, meaningful that would reshape health and social care. And it was only when I managed to become the chief officer of that as well, we could really get to grips. And what we found, I think this is remarkable, sometimes when you get a change of one leader, you can suddenly unlock some amazing people who've had all these great ideas, but they've never been backed and supported. And, you know, I think you'll find within all organisations there are people who think like you, who've got the belief and the confidence in the community. They're just not empowered to do it. They're held back because, you know, leader X thinks it threatens their status. And, you know, the NHS is just absolutely riddled, as is local government, with hierarchy and power. And you've got to be a brave leader to give away power and step back.
Over in the chat, Bill was asking a question there, making a point, and I suppose you mentioned earlier about the new local initiative and about the community paradigm and the follow-on little report that was published specifically about community commissioning, and we've looked at that in depth. But I think Bill's making the point that giving examples of experiences and complex scenarios makes it easier to copy or implement. And I suppose the question then will be, where are we at nationally across England, across the UK, with delivery of that idea of community commissioning, moving away from the marketisation of contracts towards local people leading? Are there some examples you're aware of, Donna?
Yeah, some of the best work, I think, I mentioned it to you the other day, Ian, is in West Yorkshire and Harrogate. I think they're doing some remarkable work with neighbourhoods and particularly focusing on equality and health inequalities. And that's down to good leadership. That's Rob Webster, who's really pushing that forward, who's the chief officer of West Yorkshire and Harrogate. I think there's a lot that we can learn from them. Greater Manchester are trying with the Marmot Commission. They're trying to become a Marmot city region. But again, they've kind of lost a little bit, I think, of some of the momentum that they had a few years back. And again, that's down to changes in leadership, in my personal view. So I think there needs to be, but I'm picking it up from other integrated, so I'm an advisor to NHS England on integrated care systems, and West Yorkshire stuff is the best I've seen. I think, you know, you might not think it, but certainly in Scotland as well, you're seen as being right at the vanguard of this stuff with your commitment to community wealth building in some parts, and also the Scottish Care Review, which is kind of, you know, really seen as being for children's services, being seen as a good thing because it was co-produced with 5,000 young people who are care experienced. So, you know, I think that's probably one of the best pieces of policy I've seen written for a long time. But it's patchy, Ian, is the honest answer. It's not universal. Certainly in England, with the way this government are setting out to centralise and privatise, I think the change is going to have to come from localities. It's not going to come from the government.
Yambert makes another point there in the chat about Scottish Government yesterday announced a bill to set up the National Care Service across the country in Scotland, building on a consultation and work that was done 18 months ago. Within that consultation, there's pointers of solutions. You know, here's something in Dumfries that works, therefore we should do it everywhere almost. And Yambert's asking there about, is it actually, a bit of a loaded question, is it actually sort of local common values and relationships that are formed that are important, rather than copying something from elsewhere which might have worked for a town or another city maybe?
Yeah, I completely agree. I think it's got to be local. It's got to be based on the needs of the local population. I mean, just copying and duplicating doesn't work. We've had people try to copy the deal, and it's just ended up like a PR exercise because it's not been rooted in. It's not been rooted in the place, and it's not been rooted in the communities that are in the place. So I think it's, you know, this is about listening, I think, and unless you can deeply listen to your communities, whatever you come up with, if you just replicate what somebody else has done, it's just going to be a real mess and a pointless waste of time and energy. I think you've got the first thing to do is to listen to people, find out what's working well, find out what's not working well. You know, stop doing all these duplicating projects and just make this thing that you're doing. You know, put all your leadership time into this. Because it's definitely if we're not doing this, you know, we're not being leaders, I think.
That's really inspirational, actually. Thank you. Yes. Stephanie Ann's made a point, likes the sound of becoming a Marmot City region, and lessons to learn from Manchester. Then Bridie's asked, was there a devolving to communities in a place-based sense, or was it still a citywide decision-making process? Do you want to elaborate more, Bridie?
Thank you so much, and wonderful to have you here, Professor Hall. Absolutely brilliant. Maybe just to acknowledge one or two connection problems earlier, but managed to be able to listen to another device and now to be able to ask a question. So it's really great to be able to participate. And for me, that link to community wealth building is really interesting. And I thought actually whether or not there's a level of lower level in terms of population, is what I'm thinking in terms of numbers. So our population in Manchester's in Wigan, sorry, is actually about maybe a quarter or a fifth of the population of Edinburgh. We work with 4 localities, and then within that, even we've got nuance in terms of levels of deprivation and levels of challenge that community might have, but equally actually levels of assets that those communities might have. So I'm just really curious about your experience of that in terms of actually that a place-based lens, in addition to maybe a thematic lens. For example, you mentioned those with learning disabilities, because we're hoping to look at the way community anchor organisations, but also community networks work, where a number of organisations work together collaboratively in a place to actually really make change. So I'm just really curious about the place-based lens, Professor Hall, on that. Thank you.
Bridie, thank you. That's a great question. So the first thing to say is sometimes community wealth building is badged as an opponent to community power. You know, I just can't see that. You know, we've been involved at New Local with debates with Claire's on this, and you know, I think, you know, the last thing we need, it's almost like the Life of Brian film, isn't it? Where, you know, like the People's Republic of Judea, the Democratic People's Republic of Judea. It's like, for goodness sake, let's work together. We're talking about very similar things, and what I sometimes struggle with a little bit with wealth building, because we are a community wealth building hospital, but there's not much community in it. It's procurement, it's ethical procurement, and the difference, I think, with community power is it's more of a real engagement with local people. You know, so I think we've got to work with all I think community wealth building and community power work hand in hand. For us in Wigan, and again, I know we're a lot smaller than Edinburgh, we started off with very granular neighbourhoods, which fed up, so basically wrapped around primary care networks. I don't know if you have those in Scotland, but they're networks of GPs, right? So basically you've got 4 or 5 GP practices, and that's the starting point for the neighbourhood and schools within the locality. And then they feed into populations of between 30 to 50,000. And that was defined as a kind of, it's a big neighbourhood, but that's I think all the international evidence says that's the best unit of, if you like, service delivery that you should base things on, 30 to 50,000. And in Wigan we had 7 of those. And then, so some policies, so whether it was it's a mental health support project, which was based on young people, say, for example, it would be designed with young people in mind and applied across those neighbourhoods, because young people in those neighbourhoods were all saying the same thing. But if it was something around a specific locality, for example, where I am in BL3, which is the postcode I mentioned with the high number of stillborn babies, There are very specific issues around language, culture, parenting styles, that we would want to design a very bespoke service within that postcode for people, say, for example, women from Somalia who basically had a cultural thing where they would not go to get their first checkup until they were about 3 or 4 months pregnant. It's a kind of cultural thing that's passed down from mothers and to daughters. So understanding that as a maternity service is a really essential point. How can we design services if we don't know that? So that's the kind of granularity that you need for specific postcodes, I think.
And if it's okay, I'm just going to respond on the community wealth building piece, which is I completely agree with you. I think it's almost like a sort of spectrum, and that these two things, it shouldn't be the life of Brian, you know, in terms of actually a debate between the two, and actually that spectrum of community voice and how that can grow confidence, just that one day actually people can take on bigger projects as well. And for me, I've got an example on the edge of Edinburgh. There was a Makes Sense started with some £10 from miners out in Midlothian who got together with severe unemployment. And today it actually delivers services and picks up commissions that employ local people. So yes, if people grow in confidence, then you can see organisations really taking on significant pieces of work, and that's where the two things connect. And rather than being adversarial, in my experience of community wealth building and what you're describing. But thank you so much.
That's fantastic. Thank you.
I've had a question by text on the phone from a shy participant, and what they are suggesting is that Edinburgh, and I wondered if this was true in your experience, Donna, in Edinburgh, we seem to often be stuck in a paradigm where everything is acute, whether it's delayed discharges or there's a drama or we need to really, really fix these people with lots and lots of money into acute services. And we talk about prevention a lot, but there's no resource to do investment in prevention because there were 372 older people awaiting discharge from hospital, and everything has to be about that, the acute side. How do we break that that negative cycle of having to always do the acute stuff whilst you described earlier, you need to put your leadership time into community? How do you square that circle?
That's the $10 million question, that, Ian.
Yeah. Thank you, text person.
Yeah, I mean, I think it is, and I'm sorry to keep going on about it, but it is courageous leadership. It's making the time to step back and to think, right, because if we carry on just completely, somebody once put it to me that if we carry on just repairing the fence where it's broken, rather than stepping back and thinking, right, well, if we creosote the fence this year, it's not going to break as much next year, and just making that a job in itself that, you know, will continue to twin track, deal with the problems, but also put management and leadership capacity into the redesign, the service redesign, listening to the voices of people with lived experience and staff, frontline teams, and designing it much, much earlier on. You know, the first 1,000 days was the project I led on for Andy Burnham in GM, which was basically, we weren't working together. We had some of the poorest level of school readiness. So out of 10 children starting school in Greater Manchester, 5 of them weren't ready for school at the age of 4, weren't able to hold a pen, able to maintain eye contact, still coming to school in nappies, you know, didn't have any speech or language. Now, how it's pointless creating brilliant jobs and, you know, bringing the BBC up into Salford, is it, if our children can't access those jobs, because that school readiness sticks with you for the rest of your life. So let's focus on the first 1,000 days, develop better networks with parents and support those who need our help more. You know, it's not about the Sure Start Centre, you know, it's about amazing things. I noticed there's someone on the call from Home Start, you know, it's that kind of thing we should be doing, we should be investing in.
Absolutely. Claire's asked a question about evidence. So she's asking, did you use an evidence base to help steer what areas of investment should be supported, especially about, we're interested in challenging health inequalities and other societal challenges? That's
a really brilliant question, thank you. I'm a bit rubbish on evaluation. I think, and everyone who ever came to evaluate the deal and our comprehensive performance assessment and all the King's Fund and everything said, where is your empirical evidence. And to be honest, because it's really hard, isn't it, to pinpoint how did that 13 million add 7 years healthy life expectancy? How do you know? And it's so difficult with this stuff to really nail it. We worked with the University of Manchester, we worked with the University of Huddersfield, we did so much work on evaluation. In the end, we just thought, we just can't do it. We can't prove that what we've done has made the impact, but we can make a pretty good guess that it has, because it's impossible to say whether a specific intervention or a way of working has improved an outcome, in my experience. And I think we can get bogged down and tied down with that if we're not careful. So Manchester City Council, for example, did some work with Wigan in the early days, and they wanted this real hard-edged scientific evidence base. I just said, look, this is partly a leap of faith. This is in here. It's not necessarily, statistical evidence. So I'm sorry, it sounds like a cop-out, that, but I think we can spend a lot of time on that stuff. And in the end, we're a bit disappointed because it doesn't entirely prove what we want it to prove.
Do you want to have a follow-up, Claire? Is that helpful?
Yeah, it's really helpful. Thanks, Donna. I think it's reassured me really that I don't have all the answers either, so it's really reassuring. But it was just kind of, I know there's kind of lots of research around advice services being one way that you can help families out of poverty, for example. And I was just really interested if you used anything like that to help. Obviously, Stephanie Ann, quite right, communities will tell us what works, absolutely. But is there anything overarching that helped to guide that as well? It's kind of getting all of those elements, and what you said about all the structures you used about citizens panels. Gosh, I'd love to do that with our work. I think we're not hearing as much citizen voice as I'd really like. So yeah, just really interested in any structures that are helpful.
Fantastic. We had a community partnership which was created, and there were elections to get onto that community partnership, so it was very democratic. Something that I once did in Blackburn with Jack Straw when he was the MP is one of the best things. And I keep going back to that. We had this panel called 1,000 Voices, and it was demographically representative of the borough. And we would meet every quarter with Jack Straw kind of chairing it. In a huge venue at Blackburn Rovers. He would go and speak on his soapbox outside Marks and Spencer's on a Saturday as well, kind of recruiting people to this 1,000 Voices. Real strong focus on community cohesion in Blackburn at the time. But, things like that are so easy to set up, and people love to have their say, don't they? We all love to be asked our opinion, and, it doesn't cost a lot of money to set these things up. So, yeah, it really helped.
It's something just occurred to me around the system, maybe, and around evaluation, data, evidence. It's easy to count people going through hospitals and through centralised hub services, bums on seats, number of people treated, what's your outcome in terms of your score here or your score there, or changing your blood pressure, things that you can measure. And I think sometimes the system is quite biased towards doing that because we all believe the evidence to be true. And as you've described it being a leap of faith in something in your heart, that actually we need to be talking to the Somalian women about their cultural aspects in relation to childbirth. Where's the graph? People are really attracted to the former, aren't they?
Yeah, exactly. Yeah, completely agree. And we don't live our lives in KPIs, do we? We don't. That's not the way you live your life. It's complex. So yeah, I gave up with evaluation. And everyone who came to judge us said, you need an evaluation for him. I go, but yeah, you can't do everything, can you?
Indeed. Bill's just made a very pithy point there. It's a bit like asking, where are the gas molecules you introduced to inflate the balloon? Yeah.
That's good. I like that. I'll pinch that one.
Yes, indeed. Any other questions or points? We've got another 10 minutes or so. Is it people who perhaps haven't spoken yet, or if you want to put something in the chat, that would be great. We've got some policy initiatives in the city: 20-minute neighbourhood work, community wealth building, community commissioning, Edinburgh Pact, community mobilisation, lots of community words in there, trying to join it all up, as Donna suggests. But Bridie's got another question there. Donna, hugely exciting. Your citizens panels are very interesting indeed. something that I don't think has ever been tried in that context in Edinburgh. But it was interesting to hear that you perhaps have thought before about, you know, it's called The Promise, with the thing with the 5,000 young people, etc. So maybe there's been some national work. I could stop waffling. Rasheen's put a hand up.
I was just, I was really interested by what you were saying about the management training and getting an anthropologist involved to really look at kind of how sort of people are listened to. And I think that's a really important part of this whole process. And it was just really to find out a little bit more about that and how you got kind of buy-in for people to go along with that.
That's great, thank you. Yeah, so the whole genesis of the deal was we did two things that were well, three elements of the triangle. First thing was having no money. We knew we had to do something quite radically different, and we needed to work with people to get that money out and our staff, and not to fail people really. And we didn't want to put council tax up. So we didn't put council tax up for 10 years. We froze it because we didn't want to pass the cost of austerity onto the citizen. We wanted to protect them from it. And at the end of 10 years, that freezing of council tax was equivalent to around £500 per household. So it's a significant amount of money that we saved people. We didn't put council tax up, but having no money helped to focus the mind a bit. The other thing was we did the work with Hilary Cottam, who wrote Radical Help, and we did that in a place called Worsley Mains. And the findings that we got from that, we thought these are not just around looked after children, these are findings that we want to apply to every aspect of public service in the place. And not a lot of people do that. You know, people will do an experiment or a pilot and then they'll just leave it. They won't apply the findings more generally to everything 365 days a year, but we were determined that that's what we needed to do. And the third thing was we did some work with an anthropologist who's brilliant. If you ever want to, he would be great coming to talk to this group actually. His name is Dr. Robin Pharaoh, as in the Egyptian king Pharaoh. I can send you his details if you want to speak to him. He's absolutely brilliant, freelance anthropologist. And we did some work with him through an organisation called Nesta, called Creative Councils, about 13 years ago. And that was working with groups of people accessing social care. And again, we found similar findings to the work with children, that we were processing people, you know, setting a kind of service threshold level. And if people weren't bad enough, they couldn't access it. You know, it's just awful, that, isn't it? And there was no support structure or safety net. And so Robin's work with us, he developed this thing with us, which is his idea, called the blank mind, which is basically he trained people in how to not judge people, and to kind of unwire that neural synapse and to do really deep listening to communities. And every single person who worked in Wigan and in the partnership had that training. It was called the Deal training, and he can tell you all about that. It's made him quite famous actually, so he's doing it with other councils at the moment. But you know, NHS organisations desperately need it, don't they? Because they don't, you know, they'll deal with the particular medical issue, but they don't listen. Every single serious incident we get at our board in Bolton is to do with a lack of listening. Every single one. I hope that's okay.
Yeah, no, I think it sounds fantastic.
And Claire's just pointing out that's an interesting approach, because health and social care, adult health and social care in particular in the city, has tried to move towards using what they call a 3 conversations approach to prevention, talking with people, sticking to them like glue when they are first referred or when they approach the health and social care partnership for help. Yeah, so that is a really good point, Claire. Something to follow up there. A couple more minutes. Any last points from anybody? Maybe one of the questions in my mind is about the new local organisation, Donna. I mean, I think absolutely in Edinburgh there might be either a number of organisations or a group of us who would wish to join and maybe develop some ideas working with New Local. Do they offer? Do New Local offer support? Do they link us with other people? What would that look like?
Yeah, so I mean, you could club together because it's there is a fee to pay. Unfortunately, I'm afraid, but I think we could look at a reduction for you if you know, because it tends to be councils or NHS organisations who join, but we could look at a reduced rate. Definitely, I can put you in touch with the chap who does that. But basically, it's called the Innovation Exchange. It's a network of people who, so every month there's an event which is free if you're a member, and it's. I'm not plugging this because I get paid. I do this in my own time because I really like what they do. And it, you know, they've been doing this for around 30 years, passionately believing in community power. It was called the New Local Government Network at one point, but we changed our name last year because we thought this is not just about local government. This is about everybody. But yeah, lots of work, innovation we work with. So we've been working with Michael Marmot. He's been to a few of our sessions and spoken and taken questions and stuff like that. Hillary's done the same. And yeah, picking up on really excellent examples of good practice everywhere across the UK and further afield. So we had a fantastic social entrepreneur from America at an event yesterday.
Brilliant. We'll follow that up. Thank you. Thank you so much. Yeah. Okay. Bridie.
I just want to say a couple of small things. I just want to say a huge thank you also to Ian himself. Ian did a lot of research on New Local and bringing that to us late last year, early into this year. And I just want to say thank you to Ian because Ian reached out to Donna. I also want to make a commitment. Actually, there are moments in life when you actually just come across a synergy. In our first Thriving Local event, the power of communities was really important, and that the idea of community planning was that we would hear from community voices. We've heard the same from you, Donna, today. I just want to make a commitment that actually we follow that up with EVOC as Chief Executive to find a way to get this consistent. How do we hear from communities regularly and often and different voices, the less well-heard voices? So I think it's just it's a thank you to me from both of you, and a commitment to follow through, and linking particularly into a theme we talked about is thriving local communities, and how we can help them address inequalities and those sorts of things. So enormous thank you from me. Enough. Thank you.
Thanks, Bridie. Thank you. Oh, it's been a great session. Thank you so much, Bridie, Ian and Steph. I really enjoyed it.
Brilliant. Bill, did you want to finish off with a question? Oh, you've turned your camera off. Well, no, it's hiding. That's fine.
Yeah, what I was going to say was, first of all, Donna, thank you very much. I have thoroughly enjoyed it. But when you were talking about where you are, what came to my mind was standing on the terracing, watching Martin O'Fire going by at one hell of a pace, incredibly agile, but he could take the hits. And I would reckon that the people that you're looking to interact with are people who can move around, do things really well, but can take the hits so they don't stop.
Exactly. Thanks very much, Bill. Yeah, absolutely spot on. Perfect.
Thank
Perfectly
you.
put.
With that inspirational ending, thank you, Bill. I will draw events to a close this morning. Thank you for everybody's participation. Thank you for coming along to listen. We will hopefully be doing another Thriving Local event in October, so please watch our website and social media, etc. Thank you so much, Professor Donna Hall, for your time and energy and taking this so seriously, because I think that what you've put over this morning is going to hopefully help to break that log jam that we just find ourselves in with your inspirational examples of leadership. Thank you so much.
Oh, that's great. See you again soon then. Take care.
And we'll stay in touch. Thank you, everybody.